Elimination, Martha Olson. This is Introduction to Nursing Concepts. Potter and Perry, chapter 45 and 46 will be the reading materials and the page references for this PowerPoint. As we look at the factors of elimination, we will be talking about elimination, the factors that affect that, and then some of the characteristics that go along with our bowel elimination. Our kidneys are a very vascular organ that get about 25% of the cardiac output from the aorta. We know that they lie on either side of the vertebral column underneath the ribs, so they are somewhat protected. What we know is the body has about 1 million nephrons in each kidney, and those nephrons are where urine is made, or the waste products that go in urine, and the filtering of those waste products because of that blood pressure and that blood flow. So when we look at the kidneys, we spend a lot of time looking also at the blood pressure and the vascular system to help us maintain our homeostasis. This is on page 1042. The kidneys, we see the loop of Henle listed there, and if you've taken pharmacology, you know that that loop of Henle represents where some of our diuretics, our loop diuretics, are starting to have their effect on the urine output by increasing the amount of urine that the kidneys are able to eliminate. Our glomerulus then helps us to reabsorb and secrete ions and filter the wastes, help with the electrolyte and acid-base balance of the body, and we know the glomerulus is where urine formation actually begins. Water is brought in by the afferent arteriole into the glomerulus, and an infection to this part of the body then would be called glomerulitis, and it's a very serious infection that the person is usually hospitalized on IV antibiotics. The ureter's purpose is to carry the urine from the kidneys to the bladder. The kidneys are not able to hold a large volume, and so they need that ureter to be able to get the urine down to the bladder where it's a holding tank. It can stretch and store urine for a period of time until it is eliminated. When we look at the ureters, there are principally three things I think of that go along with that. A kidney stone that gets stuck in the ureter is very problematic. First of all, it's painful, but it causes the urine to back up then into the kidney and cause possible kidney damage. We look at strictures or narrowing to the ureter that will not allow the urine to flow easily from the kidney to the bladder. And then the third thing that I think of is the person that goes for surgery, and if the surgeon would accidentally nick the ureter during an abdominal surgery, they could be leaking urine then into the abdominal cavity, causing a lot of flank pain, something we have to look out for as post-surgical patients are in our care. Our bladder and urethra then, the bladder is just that organ that's able to stretch. It is the holding tank for urine, and we know that the urine holds so much, and then the person feels the urge to void. The person that lets it get over distended, either because they are unable to void or have other complications such as paralysis from the nervous system, then sometimes have to either have a catheter or suprapubic or do a self-cath at that time. As the reservoir for urine, we know then that that can be a place for bacteria to grow because the urine is a warm, moist medium. And the urethra, big difference between male and female because the male urethra is much longer, and men have a less chance of getting a urinary tract infection because their urethra is about 20 centimeters long versus a woman who has a 2 to 3 centimeter long urethra, where the bacteria from the outside of the body can travel into that area and cause a urinary tract infection. When we look at the functions of the kidney, we are going to do an activity in class, but really study page 1043, also figure 45.3, where we're looking at that renin-angiotensin-aldosterone system to help maintain our blood pressure. We know angiotensinogen is made in the liver. It then causes the angiotensin converting enzyme in the lungs to cause vasoconstriction. And if you've been studying your blood pressure meds in pharmacology, you see some very similar words, and that's because some of the blood pressure medications then are actually vasodilators by affecting these hormones that cause vasoconstriction in the body. Functions of the kidney. Besides maintaining the blood pressure by either holding in urine or eliminating urine to help control the blood pressure and removing waste from the body, we see the word erythropoietin, which is the red blood cell production. The kidneys make that erythropoietin. In the bone marrow, then it stimulates the red blood cells to be made. And a patient with chronic kidney disease, then, if you think down the line, would have a decreased red blood cell count as a result of their kidney damage not allowing the body to make that erythropoietin. There is a medication called Procrit that patients that have kidney failure can be given, or cancer patients, to help stimulate red blood cell production. And then bone mineralization is also the other function of the kidney. So they're very important organs in the body. When we look at the process of elimination for feces, we know it's from the mouth where food is taken in, all the way down through the rectum where it is eliminated. On page 1087, it talks about each of those structures. Our fecal characteristics we'll be talking about a little more in class. On page 1089, we know then that we will be looking at and describing fecal characteristics in our documentation and charting, because that can tell about the health or disease of that colon for the person. Factors that affect urinary elimination on 1044, we're going to be talking about the retention, the urinary tract infection, the incontinence, and then also how age can affect urinary elimination. The diagnostic tests, when you read those in the book, you'll want to make sure that you're thinking about which one you would have performed first and which one you would have performed last, because any of your tests that have dye would be the ones that would probably go last. Anything that doesn't involve any prep would probably be done first. So in looking at this list of diagnostic tests here, I would choose the very bottom one, the urinalysis, because all a person has to do is simply void into a cup and we send it to the lab to be evaluated. There's no prep, there's nothing that needs to be done, and no consent that needs to be signed. Our normal bowel characteristics then, as we look at the functions of the GI tract, we know that the absorption of nutrients, this should be review from nutrition. So if you don't remember Unit 2 from the nutrition class you took, this would be a good time to pull out those notes and kind of review them again. To promote normal elimination, we know that the sitting position is much preferred over a bedpan. And if you can even get a person up to a bedside commode, that will help them to be able to eliminate easier. Providing privacy, encouraging a diet that promotes bowel elimination with fiber and fluids. Exercise is also very important to continue with that peristalsis. Other factors then that can affect elimination are on page 1089. We know that the pain of surgery along with narcotics can have a negative effect on bowel elimination, as well as pregnancy in that third trimester when that very enlarged uterus is pressing on that lower colon, sometimes causing women to have problems with elimination during those last 3 months of their pregnancy. The 4 F's of constipation are food, fiber, fluid, and fitness, if you need a quick way to remember a few of those. Our GI system, as I said, our fecal characteristics. In the book, it talks about the shape and how we scale it from 1 to 7, so that when we are documenting, it's much easier to document it on a scale that is very consistently used throughout the healthcare system. Diseases such as Crohn's, ulcerative colitis, irritable bowel can cause things such as diarrhea and constipation for our patient. So when we think about the following factors that decrease bowel elimination, I hope you're able to identify that immobilization, narcotics are the 2 in this list. Caffeine actually promotes bowel elimination, and some of your older people in the nursing home will drink coffee or hot tea, and it does promote bowel elimination for them. And high fiber foods, as we know, are very good for promoting bowel elimination. Our characteristics then, we want to try to maintain the habits that a person has at home. If we can get them in the bathroom and shut the door, the patient will feel much more relaxed and be able to have a better outcome of their elimination. We want to encourage fluids unless it's prohibited from their diet. If this is a patient that has congestive heart failure, obviously we would not be able to encourage a lot of fluids, but drinking 6 to 8 glasses of water or other fruit juices that have the fiber in them would be helpful for that. With bladder elimination, we are looking at promoting bladder elimination by the Kegel or the strengthening exercises of that pelvic floor. Some of our modified sit-ups are also beneficial to help strengthen the musculature of that bladder floor. And then the Cride's method is a manual bladder compression that we don't often use. As we look then at elimination, we will be comparing and contrasting between the bowel and the bladder in this from chapter 45 and 46. We also need to keep in mind of what would the nurse do? What is the role of the nurse in elimination? Not just memorizing the facts or the list of things in there, but if your patient is constipated, what would be the first action a nurse would take? Start thinking about which would be more serious or more concerning to you if a patient had constipation or diarrhea, or if a patient had urinary incontinency versus urinary retention. In those cases, which patient would you be most concerned about, and do a good assessment and then call the physician. We have 4 units with this series, so I will close this one out and start the second PowerPoint. Thank you.